Okay, so this is entitled Reclaim Your Health and Your Life, Giving the Gift of 120 Healthy, Happy, and Productive Years. We want to teach you how to attain and maintain the ultimate state of health so that you can live 120 healthy, vital, and active years. If you're not a patient, you will want to become a patient so that you can receive the appropriate health guidance on your journey to health. So what are you going to learn? You're going to learn what is health, why do people get sick, and I know you probably think that you know the answers to these things, and most people actually find out that they don't. Can we control our own health destiny? Do medications cure disease? Can we prevent disease? Heart disease, cancer, diabetes are the three most common in society today. And how can we live healthy, disease-free lives? And what we call the 5 factors or 5+ factors of health. So what is health? Health is basically, with the number one answer that I always get when I ask patients this, what is health? People will say, well, health is feeling good. All right? And that's partially true. Yes, when you're healthy, you usually are going to be feeling good. However, just because you are not healthy doesn't mean you're going to be feeling bad. Okay? Feeling good, yes. Feeling good is important, but the number one reason or the number one answer should be 100% function. If your body is functioning at 100%, you're going to be healthy. If your body is not functioning at 100%, you're not going to be healthy no matter how good you feel. Now, let me explain that a little bit more. Let's say you feel absolutely terrific. You go out for a dinner, let's say Chinese food. Okay, not that I'm picking on one particular type of food, but you go out for Chinese food and instead of getting Chinese food, you end up getting ptomaine poisoning. So a few hours later, let's say 2 or 3 hours later, you start to sweat, you start to perspire, you have that regurgitation in your stomach, you feel nauseous, you're about to vomit, you run to that bathroom, you sit down on the floor next to that porcelain tub, you are overheating, so you put your face against the cold porcelain tub, which makes you feel so much better, of course, and you can't wait, or not that you can't wait, but you really want to vomit because of the fact that you want to get rid of what's inside of you, okay? And that's the important thing, because your body is recognizing. The universal intelligence, or what we like to call the innate intelligence of the body, is recognizing that there is a problem. So what the body wants to do is it wants to get rid of the poison, right? And the only way to get rid of the poison is through here and through here. That's it. There's only 2 ways. So the body wants to do it as quickly as possible, and that's what happens. You start to vomit, you develop diarrhea, and that's fortunate because of the fact that what most people will say is, well, I'm sick, I'm not feeling well. No, okay, you're not sick. That was a healthy response, okay, to the ptomaine poisoning. If your body wasn't functioning at 100%, guess what would happen? You wouldn't vomit. You wouldn't develop diarrhea, therefore you wouldn't get rid of it and it would kill you. Okay, so that's an important factor to understand. So just because you're not sick doesn't necessarily mean that you're healthy, and just because you have symptoms doesn't necessarily mean that you're sick. It could be your body's response to a particular type of a disease. Heart attack, cancer, high blood pressure. So just before you have a heart attack, and this is something that I bring up to patients all the time, 5 minutes before you have a heart attack, you could be feeling absolutely terrific. Are you healthy? Well, people would say, yeah, I'm healthy, I feel fine. And 5 minutes later, you drop dead of a heart attack. All right? You don't just drop dead of a heart attack when your body is functioning right. There's something going on. Your coronary arteries are blocked and you don't know it. There could be neurological things going on that cause the heart attack. So there are many different factors that can be causing it, and they're developing in your body at this very moment, it could be, and you don't even know about it, okay, because it's not causing symptoms. Grey's Anatomy, which is the Bible, we're not talking about the show, the TV show Grey's Anatomy, which is spelled with an E. Gray's Anatomy is a book about this thick, and it is the benchmark of anatomy. All right. So any medical doctor, chiropractor, dentist, whoever the health professional is, they have a copy of Gray's Anatomy, and it describes health as being the ability of the body to adapt to internal and external stress. The ability of the body to adapt to stress. Okay, so in other words, when we talk about stress, we're talking about internal stress and external stress. All right, internal stress, emotional stress, the things that the stressful situations that we may go through that can overwhelm our body. But we're also talking about external stress, and when it comes to external stress, the stresses that we place, the physical stresses that we place on our body, whether it has to do with physical stress, sitting all day, or working, in the mines, and therefore it's very physical work. All of these things put a great deal of stress on our body as well. So we have why do people get sick? Germs. Germs is the #1 answer. People say, well, yeah, you contracted some sort of germ. Okay, not necessarily so. It's a combination. What about the people who don't get sick when they're faced with the same germ that you may be faced with? Not enough medication in their blood. Okay, people say, well, yeah, I need antibiotics. Okay, so does that mean that when you get sick, you don't have enough antibiotic in your blood? Well, yes and no. And the body cannot fight disease. That's actually the right answer. The body cannot fight disease. So what happens is there are germs present. There are germs present in life right now. There's germs present, believe it or not. No matter how much we clean the office, no matter how much you sterilize things, there's going to be germs present. All right? But yet, we don't always get sick. All right? If you take your finger, put it in your mouth, you know how many germs I just put in my mouth, okay, that are on the surface of my skin? Except for the fact that I'm not sick. And hopefully I'm not going to get sick in a little while. All right? But the bottom line is this, okay? It's your immune system the sole purpose of the immune system is to fight off disease. And as long as you could fight off these germs that are present all the time, you're not going to be sick. But once you stop fighting them off, in other words, when your immune system is not functioning 100%, that's when you're going to get sick. This is an interesting article that I found, a little blurb in the New York Post, okay, because being from New York, I always read the New York papers, and what happened? It skipped it. Oh, sorry about that. Okay, we'll move on. So how do people get sick? Less than 100% nerve system function. Poor nutrition. Okay, we are what we eat. Environmental pollution. You know how many pollutants are in the air, especially these days that we're actually breathing in? Chemicals in our food and water. Okay, if you're not eating organic foods, that's a bit of a problem because of the fact that you're taking in a lot of toxins. Medications. Okay, if you medicate yourself, okay, that could be, there are people that live on medications. The average person who is 50 years of age and above lives on anywhere between 6 to 10 medications every single day. Smoking. There are still smokers out there. There's also secondhand smoke, and that can be causing health issues as well. Lack of rest, lack of exercise, and poor attitude. Basically, they don't care. Health is our destiny. We destroy our own destiny and we don't even realize it. Okay, health must become a priority in life. Health must be the #1 priority. Without your health, nothing else really matters. Okay, but unfortunately, people wait until they get sick, seriously ill, before they attempt to do something about it. Your family relies on you to be healthy, all right? You have kids, you have grandchildren, they need you. They want you around, all right? We were born to be healthy. The Bible says we're supposed to live 120 years. That's where I got the title for this. Yet, how many people really live 120 years? Okay, because of the fact that we are destroying our own bodies. So should we focus on health or should we focus on disease? What you focus on becomes your reality. Unfortunately, these days, most of the medical profession focuses on disease. Wait till we get sick and then we try to do something about it. I would rather prevent it in the first place. So health, according to Dorland's Medical Dictionary, health is a state of optimal physical, mental, and social well-being, and not merely the absence of disease or infirmity. Okay, this is probably the second best, not probably, but it is the second best definition that I've seen in addition to Gray's Anatomy. So 100% nerve function, okay? The number one factor, okay, or at least first on our list, the nervous system, as you know by now, consists of the brain, the spinal cord, and spinal nerves. Very similar to an electrical system. Okay, we have a power source, a generator, a battery, and wires. Well, the brain, the spinal cord is just simply an extension of the brain, a thick extension, and then it gives off spinal nerves or wires that go to each part of the body. Every organ, every muscle, every tissue is in fact connected or communicates with the brain through the nervous system. It's like I said, it's similar to an electrical system. The electrical impulses or the power must be at maximum. Otherwise, we develop things like short circuits, or I should really say that short circuits will result in submaximal impulses or submaximal power. It supplies energy to every part of the body, including the heart, the lungs, the kidneys, the spleen. Every single part of the body has to be in communication with the brain in order to function properly. And the most common short circuit that develops, okay, is something called a subluxation. A subluxation is when a bone moves out of place, becomes locked or fixed or stuck in the misaligned position, and it pinches or irritates a spinal nerve. You can see that there are 4 bones here. These are the individual vertebrae. There are 4 of the persons facing to your left. The first bone, the third, and the fourth are in their proper alignment, but notice the second bone is shifted backwards and downwards. These are the individual nerves that exit the spine. Notice that the first nerve is pretty thick and healthy, and the third one is thick and healthy, but this second one is a scrawny nerve, which tells me that it's been around for a while. Okay, that nerve is not functioning properly. It's not carrying the 100% nerve flow to whatever part of the body it's going to. So a subluxation causes a malfunction to a nerve. The malfunction to the nerve then causes dis-ease, D-I-S-E-A-S-E. Basically means a lack of function. Okay, a lack of harmony will result from dis-ease. A lack of harmony, all the organs in the body are dependent on each other, and when there's a problem in one area, then it's going to cause problems in other areas as well. Subluxations can cause symptoms, okay, or eventually will cause symptoms. Very often when they first develop, they don't cause any symptoms at all, okay, which is unfortunate. It would be better if they did, but the body tries to compensate for any type of ill to it. Pain, tingling, numbness, disc pathology, disc degeneration, herniated disc, bulging discs, these are the things that will develop from subluxations. Asthma, allergies, digestive problems, reproductive and urinary problems, and then also it doesn't even have to cause symptoms, but it will cause future problems. And most subluxations develop, they don't develop into symptoms. They don't manifest themselves into symptoms until months or sometimes even years later. Subluxations are the silent killer. I like to call it that because of the fact that in most cases it's not causing symptoms. Okay, the spine is the most neglected aspect of a person's health. Okay, when I was in New York, I used to go into the schools and teach the kids the importance of taking care of their spine and how to take care of their spine, so that this way from a young age they don't have to develop the problems and they can maintain their healthy spines versus later on in life when you have people who neglect their spines and then they develop problems and wonder why they got it. They said, all I did was just bend down to pick up a pencil, or I sneezed and I developed a herniated disc. No, that was developing over a period of time, and then that might have been the straw that broke the camel's back. So subluxations must be corrected, and as you know, that's what we do as a chiropractor. I'm also a chiropractic neurologist, so I get into the nervous system a little bit more than the average chiropractor, and I have unique treatments as well. Diagnostic testing that I do, and also I get into a little bit more of the treatment, especially for herniated discs and pinched or irritated nerves, than the average chiropractor. Superior nutrition. Superior nutrition is very important. I don't just say good nutrition because it really has to be superior. Over the past 30 years, hypertension rates, okay, high blood pressure has drastically increased. Cancer has drastically increased. Diabetes. I don't know why this is switching by itself, but in any case, let's go back. Diabetes, childhood obesity, all have skyrocketed, okay? And yet with all of the new medications and everything on the market, and I'm not saying that they're not necessary, there are times where they are. However, the problem is that they are causing other problems. So it's basically you're taking care of one issue and it's causing something else. Number of fast food restaurants have more than doubled over the last 30 years, 131 billion in revenues. That's according to the National Restaurant Association. 66% of adults are overweight, 31% of all children are overweight, and 33% of all children have at least one fast food every single day. That's a problem. And this is causing issues. But the thing is that you're not seeing the issues that they cause until years later. Yes, you will see them getting heavier, but as far as the health issues are concerned, they don't manifest themselves until years later. People are not eating the right foods. Junk food is the primary food that people eat. Superior nutrition, high fat versus low fat. You hear about some, you rarely hear about high fat except for Atkins diets. High carbohydrate versus low carbohydrate, and high protein versus low protein. The thing to remember is there's an acid-alkaline balance that has to be maintained in the body. And unfortunately, most people are too acidic. All right, they have to become more alkaline. Okay, if you remember from high school biology, okay, acid base. Base is alkaline, acid is acid. Okay, it's too acidic. So the lower the number on the pH scale, the more acidic you are. And we're talking about a very fine line between being acidic or alkaline. The blood needs to be anywhere between 7.365 and 7.45 in pH. All right, but unfortunately, a lot of people are 7.32, 7.30. That's very acidic or considered very acidic. All right, you want to be more towards the 7.45. The blood pH, as I said, 7.36. Think green. Green is what vegetables, even some fruit, allow for an alkaline environment in your blood, okay, and your urine. Acid disrupts the balance. Acid weakens red blood cells. It destroys them. Red blood cells die, and what do they release? More acid. So it compounds itself. But the body tries to compensate with alkaline reserves. Alkaline reserves become depleted, and the acid starts to actually burn the blood vessels, and eventually will cause hemorrhaging. The body compensates by lining the walls with cholesterol. Okay, you've heard that before. Arteriosclerosis, we develop arteriosclerosis. It's basically a compensation, and very often it's a compensation because of the blood is too acidic. So it's kind of a protective mechanism. However, that protective mechanism can also cause problems because there's hardening of the arteries. The arteries are supposed to move, they're supposed to be flexible. They become less and less flexible, and then they could break or rupture. Three-step cycle of regaining balance. Cleanse your system ideally for 7 to 10 days, meaning going on some sort of a water fruit fast is the best thing that you could do for yourself to really cleanse yourself out. Interrupt destructive patterns. Stop indulging in negative emotions and eating acidic foods, and especially eating those foods at night, okay, before you go to sleep. A lot of people will do that. You want to provide your body with core nutrients. The water, 50% of your body weight in ounces. Okay, I actually recommend standard 100%, 100 ounces per day of water. Why? Because water cleans your body out, and it's important. It flushes out the kidneys. Oxygen is very important, but not only taking the oxygen in, but getting the oxygen to the various cells in the body that require it. Because if cells don't have oxygen, they die. Vitamins and minerals, the appropriate vitamins and minerals, and I always discuss that personally with each and every patient. And fresh alkaline foods. Alkaline foods meaning the greens. The more greens you have, salads are so important. That's basically what I eat. Salads. My meals consist of salads and some protein, very low fat. Okay, that's the key thing. So you want moderate amount of protein, low carbohydrate, and low fat in general. Weight loss. Okay, weight loss is important if you need to lose weight. Okay, dieting does not work, and that's why I really concentrate on weight management rather than weight loss, and I'll explain why in a second. So dieting doesn't work. Why doesn't dieting work? Because you go on a diet, there's a start to a diet, and there's a finish, there's an end. So what happens is as soon as I want to get down to 150, I want to get down to 150, I want to get down to 150. So you slowly lose the weight, you get down to 150, great. The day you get down to 150 is the lowest weight you're going to be, because what happens then is psychologically, okay, I'm done, I've made it, victory, okay? I've conquered the obesity, that obesity factor, and therefore now I can live life the way I always did before. That's the problem. Okay, they don't change their attitude as far as eating is concerned. They don't change their attitude as far as overall health and wellness is concerned. Okay, you have to change your lifestyle, and that's what people don't do. So therefore, you can't go back to eating those fried foods or anything else. You have to get the one sole factor that you have to dwell on is the fact that in order for you to maintain your health, you have to eat a certain way, eat a particular lifestyle. And therefore, what happens is when you slowly go back to the old way, which is what the average person does, you're going to put the weight back on, and very quickly also. As a matter of fact, the statistics have shown that the average person who loses weight regains that weight plus another 10% within 2 years. Which means that if in 2 years you want to be the same weight you are right now, the best thing you can do is not diet. Think about it. So aerobic, anaerobic exercise, proper exercise every single day. The government used to recommend 3 days a week of exercise, and then a few years ago, it's probably more than a few, probably closer to 10 years ago, they realized, you know what? We told people 3 only because we knew that they wouldn't exercise every day, but they really need to exercise every day. Okay, that's the bottom line. I'm up at 6:30 every morning, out running. I've been doing this for 40 plus years because of the fact that I want to keep my heart and lungs in good shape. Bicycling, all different types of aerobic exercise. Swimming is an excellent form of exercise because it doesn't put stress on your body. Okay, so aerobic exercise, very important, again, for the heart and lungs. Anaerobic, for your structure, for your muscles. Okay, you want to keep good muscle tone. You don't have to have these big bulging muscles like weightlifters do. Okay, you can lift a milder or lighter weights, and all you want to do is just build up good muscle tone, and you're going to look good also. Okay. Find an exercise that you enjoy. You have to have a burning desire to get up early and exercise. There's no doubt about it. But the burning desire can't be just to exercise. The burning desire has to be, real simple, the burning desire must be to be healthy. That's it. If you have a burning desire to be healthy, you're going to make the necessary changes in your life, and you're going to maintain those changes throughout your lifetime. Okay? Because of the fact that it's not congruent to eat junk food if you expect to live 120 years. It's just not going to work. Exercise lowered diabetes risk, but obese patients benefited significantly only by exercising at least 5 times weekly, and that's according to the American Journal of Medicine in 2009. Government's recommendations changed in 2008. Adults should get a minimum of 2.5 hours of exercise over at least 5 days per week. Okay, I'm saying 7 days. And one of the reasons is psychological, because if you take off 2 days, then it's easier to take off that 3rd day. Why did the President's Council on Physical Fitness used to recommend only 3 days of exercise? Well, I got into that before. Rest. Rest is very important. Sleep is the maximum state of physiological rest, and you have to get proper amounts of sleep. Good mattress. 1/3 of your life is spent in bed. You want to have a good, firm mattress. I happen to like the number beds, the sleep number beds made by Select Comfort. There's one on Fruitville. I believe they're still there. Okay, 1/3 of your life is spent in bed, and therefore 8 hours out of 24 hours approximately, if you're on a poor mattress, it's going to slowly cause spinal problems. So therefore, the thing I like about the Select Comfort, that's the one where you blow up. It's not like those cheap air mattresses. You blow them up, and then you let out a little bit of air at a time, and it conforms itself to your spine. So it's almost like having a custom-made mattress. Plus the fact that it'll be the last mattress you buy. I bought mine in 1995 when they first came out, and here it is how many years later, and we still have the same mattress. There are no springs in it to wear out. Good pillow supports your head and neck. Okay, you want to have a little bit of a bump over here, which fills in the space between your ear and your shoulder when you are lying on your side, and it fills in the space because the overall neck curve should be a C type of curve. So you want to fill in that space and support the neck while you're sleeping. Anything in life you think you want, you only want because of the feeling you believe obtaining it will give you. Anything in life you think you want, you only want it because of the feelings you believe, the feeling you believe obtaining it will give you. Everything in life is feeling. So what you have to do is you have to first change your attitude, your thinking, and that will change your feeling. Our lives are defined by the emotions we feel on a daily basis. Emotions are signals calling us to action. We can change our emotions instantaneously. You can instantly change your emotions, okay? And then by changing your emotions, you're going to then change your feelings. It does take a little bit of time, but the emotions can be changed instantaneously. And that's the thing, no matter what the situation is. Okay, I'm having a little bit of a problem with this computer here. Emotions and feelings can be changed from moment to moment depending on what you believe is true. So what you have to do is you just have to change your attitude as far as what's true and what's false. Okay? If you believe that eating McDonald's is going to allow you to become healthy, you have to change that attitude, and that can be changed just like that. Okay? There is no way to happiness. Happiness is the way. The late Wayne Dyer said that, and I love that comment, okay, that statement. There is no way to happiness. Happiness is the way, it's the journey. Everything we do and don't do is based on a pain versus pleasure principle. I can't get into that too much right now because you could spend an hour on it easily. Okay, everything we do and don't is based on pain and pleasure. We have two fundamental drives. Avoid pain and gain pleasure. No matter what we do, we want to avoid pain and we want to gain pleasure. And you would think that gaining pleasure is the stronger of the two, but it's not. Avoiding pain should be the stronger one. All right? So what you want, no matter what the situation is, you want to avoid pain, whether it's physical pain or emotional pain. All right? Versus gaining pleasure. What a lot of people do is they just think about the pleasure aspect. So if you're going to eat those cookies that you know you shouldn't be having, but you want to gain the pleasure of eating it. So you put it in your mouth, it's in your mouth for 30 seconds, if that long. You eat it going down, you still have taste buds in your throat, so therefore you do experience the pleasure. Once it gets to your stomach, you stop experiencing the pleasure, and then what happens? There's going to be pain, because that pain is going to be future pain, because eventually it's going to clog your arteries and that sort of thing. So what we have to concentrate on is avoiding the pain and not worry so much about the pleasure, because the pleasure is going to come once we avoid the pain. We have to stop with the pleasure. We live in an instant gratification society, and everything is based on pleasure. Okay, we have to get away from that, and we have to concentrate on the pain. So you have to think to yourself, okay, I want to be healthy. I want the pleasure of being healthy, which means what goes with it. Feeling good, being able to do things in life that you want to do, living and leading a high quality life, all right? At the same time, though, you want to avoid the pain. The pain is going to be being sick, developing cancer, diabetes, heart disease, and that sort of thing. So the average person will do far more to avoid pain than we will to gain pleasure. If you keep procrastinating, eventually the pain of not doing it will become greater than the pleasure and benefit of avoiding it. Okay, that's something that you have to just think about. So you want to associate pain You must change the neuroassociations in order to change the behavior. Hot dogs and cold cuts are a perfect example. When I was a kid, I grew up on hot dogs. Pastrami, corned beef. I had a Jewish mother, okay, and that's what she would feed us. A lot of corned beef, pastrami. They're full of nitrates and nitrites. They're horrible for you. They basically end up in your arteries, all right? Plus the fact that they have the chemicals that will destroy your organs on a very gradual basis. And I used to love the taste of hot dogs and cold cuts. And then I started visualizing, and I said, well, wait a second, let's just say that if I continue to eat these foods, my arteries are going to get clogged. So I would visualize what the blood looks like with fat in it. And it became a disgusting thing. So here it was, I was taking something that gave me a lot of pleasure, and I was making it so that I would feel less pleasure. So yeah, maybe it tasted good in my mouth, but I was picturing what it's doing to my body, and that disgusted me. Okay, I was disrespecting my body, and eventually what happened was that became stronger. So the fact is that I wanted to avoid the pain, the painful experience of developing heart disease, of developing cardiovascular peripheral artery disease. All right, I wanted to avoid that, and that became more important than the pleasure of my taste buds. Eliminating chemicals, the air in the air that we breathe. Okay, you want to use air filters at home and at work, which will clean the air of probably 95 to 98% of the contaminants. Water, drink bottled water. Don't reuse plastic.